Hello, it's Phil Jacobus again, and today I'm joined by Tom Petrone, who's a medical physicist and the CEO of Petrone and Associates. Tom, how are you? And thank you for joining me.
Oh, I'm fine, Phil. Thanks. How are you?
I'm alive. I'm living the nightmare.
There you go.
Tom, I know that you work with Elmhurst Hospital, and Elmhurst was one of the hardest hit institutions in the world. What was it like working in that environment?
Well, I mean, Elmer, we service a number of hospitals throughout the New York City area. Many of them are municipal hospitals, and they're large, and they serve a large population. So that area of the city is no exception to the population density that you see in the tightest corners of New York City, and with many people living above the stores, and a lot of them do use the emergency room, as their primary doctor. That just happens to be the way it goes. And so they're typically busy to begin with. So when you could imagine when the panic hit, a lot of people started lining up around the corners and inundating the emergency rooms. We're not there delivering direct patient care, especially on the diagnostic side. Just to back up a little bit, our practices on the therapeutic radiation oncology side, as well as diagnostic imaging. At Elmhurst, we're more or less involved in the imaging side. So we had no access to the imaging equipment in the emergency departments. So that was that. It was a basic frenzy. We are not, like I said, in the absolute front line. We're a big step behind that, focusing on machines. But our staff was witnessing this every day. So it took a lot of discussion back and forth about how to, sort of navigate the unusual terrain, if you will.
Let me ask, why are the services of a medical physicist deemed essential?
Well, I mean, that was a question in the beginning. Would we be deemed essential? We thought we would. We are medical physicists, I guess you would call them experts. So we like to think of ourselves as experts in the application of radiation in medicine. As you know, going way back, well before Hiroshima and Nagasaki, there's a fear about radiation because radiation utilized incorrectly can cause untoward effects, either to the patient or to the progeny of the patient populations, etc. So radiation is very heavily regulated in medicine. So we are employed to, on the radiation oncology side, actually help deliver, design, plan the radiation that's used to treat cancer patients. So, it's hard not to see that as essential, right? Cancer treatments did slow down for a number of reasons during the crisis, but it never stopped. So on the radiation oncology side, we had to be there every day doing what we do because of our knowledge of the machinery and the interaction of radiation for the treatment of cancer. On the diagnostic side, there's a lot of regulations that require us to monitor the machines on a regular basis. Taking, CT, for example, we've seen all the articles about how CT, if unchecked, can lead to overexposures, epilation, loss of hair, skin reddening, and other potential effects that might, be 20, 30 years down the road if it's not used properly. So we're not necessarily into minimizing radiation, but our role is to really optimize radiation. So on one side, we want to make sure we're not delivering, and the regulations cause us to have to do this on a regular basis, measuring machines. We don't want to overutilize too much radiation. On the other side of the coin, we're very much involved in optimizing image quality, and the downside to going too low on radiation, as you know, because you're in the field, is a loss of image quality. And especially with regard to the COVID patients, the doctors in the ED were doing CT scans, looking at certain patterns in the lung to see whether they were associated with the particular disease or the symptoms that COVID was bringing these patients in with. And if you were to use too little radiation in that sense, you might actually obliterate that image quality and not be able to diagnose this patient. So why are we essential? It's a long-winded question. Without optimization of radiation medicine, you can affect the diagnostic accuracy of the machine, or give more radiation. We make that decision. No, the regulators basically said, keep doing your job. You know, within whatever limitations you might have, but keep doing your job. So that's why we were, I guess, in a sense, lucky enough to be deemed essential.
You talk about regulators. How has it been difficult dealing with regulators during the crisis? Is it the same? Is it easier? Is it harder?
Well, you know, it's a communication that you always have. We are, you know, in applied medical physics, so we do a lot of regulatory work. So we are in constant communication with the local authorities, and then stretching, we go out to the state. We talk to them periodically when needed, and of course, there's the accrediting bodies, Joint Commission, ACR, et cetera. So is it difficult? No, but it is a conversation that has to be had. There are regulations. So during the crisis, there were certain things we had to ask them about whether or not we could perform our duties in an alternative manner, you know. And it took a discussion. We opened up, we wanted to talk about the National Tennis Center. I can talk about that now if you want. You know, there we had to sort of not circumvent, we had to fast track the approval of them to use radiation equipment at the National Tennis Center, which was, you know, in a typical setting, you would have to take months to get that done. So we worked very closely with the New York City Department of Health, and they were very, very helpful through several phone conversations. We basically did what they asked us to do in terms of assuring safety and whatnot, and they were able to give us the approvals very, very quickly to do that. So yeah, we had to have some conversations during this. Also, on the other side, you know, we were asking for them to do whatever they could to lighten our, you know, regulatory burden within reason, as long as safety wasn't compromised. And they gave us the opportunity to, if well documented, and there was no, you know, untoward potential effect on patients or staff, to either delay testing in very, very critical areas. They did. The proviso there was, though, that everything had to be very, very well justified in terms of delaying any regulatory required measurements on machines, and very well documented. All right, and so they weren't giving us a general pass, but they were saying, if you are definitely not able to do something, you need to justify it and document it well. So for the most part, we were required to do everything from the regulator standpoint, you know, up to a 98% capacity.
Well, it sounds to me like there's a lot that goes on behind the scenes that not the average person isn't familiar with. And I guess we're lucky to have medical physicists on the scene. So Tom, I want to thank you for joining us today. And I look forward to seeing you at an upcoming trade show.